when I went to Germany, I did have a kidney stone. It's a different story, but one of the people brought up this thing of someone from outside the state having a car accident and coming in. I was worse than that. I had a kidney stone while I was in Berlin, in Germany. They billed me. I contacted my insurance company and I filled the forms out, and they wanted some documentation. And quite honestly, to make a very long story very short, by the time I could gather the documentation and submit it to the health company, the health insurance company, I had gone past their parameter for what would be the longest time they would wait for me to gather that documentation and submit a billing. I paid $1,000 to the hospital in Germany, and I snickered from the standpoint of they wouldn't pay me $1,000. If I stayed in any other hospital, I've had a number of kidney stones in this country, I think my minimum cost for an evening, not for a week, for an evening, has been $5,000 right off the bat. I don't know how to make that out, but I guess my real question is going back to, if there is someone who comes into the state and has a medical emergency of any kind, and we take care of them because we have to, how are we going to handle this? Because we're now in a situation where the rest of the country is going to be running on the old insurance gambit, and they're going to be charging, well, we'll be charging those people, the same situation, $1,000 for our work, which is reasonable. But the rest of the country is going to be running on the old standard of $5,000 for an evening. I don't know how to put that forward, but I see it as a major financial problem from the standpoint of trying to make this work.
Well, very simply, under this system, the Pennsylvania Health Care Board sets the reimbursement rates for doctors and hospitals for the services they provide. They are setting the reimbursement rates. If a person from out of state is injured in this state, and they use the facilities of a doctor or hospital in this state, their insurance company will be billed, or they will be billed, at the cost that we have set for the medical reimbursement rates.
Okay, that's it.
I'm working my way over to Breezy, and as I'm going there, I'm wondering, did I hear you say that dental is covered in a
Yes.
single day?
Yes.
Is that fully covered? I mean, 100%.
At the moment, it's 100% covered.
And we should point out that what you might call vanity care or cosmetic care, right, is not covered. We should be clear about that.
An incident in our bill is 27 pages long, right?
Yeah, that's right.
It's not 27.
Well, that just adds something. I went to surgery, and I was curious how I suspected it wouldn't be covered, but I was trying to make sure. The other thing is, as far as, benefits to the patients are obvious, but as far as doctors' fees and stuff, would there be a situation where doctors may not be staying in the state because they could get paid more in other states? Again, creating a dream of doctors in the state.
Well, we intend to create a competitive marketplace for healthcare services. So if there are other states that under one way or another they are substantially reimbursing doctors at higher levels, we have to compete. Ultimately, we want to create a free market, a free market for healthcare services. So we have to be competitive.
But under our system, the doctor only has to deal with one insurer. The payer is the insurer, which is the state of Pennsylvania. So they're dealing with one set of forms, not from 1,500 different insurance companies and 100 different plans or 1,000 different plans or whatever. So that's a secret cost control too. Everybody's in that risk pool, everybody's in one plan, and therefore that eliminates a lot of costs for doctors. We're getting rid of a whole bunch of people that work out front. Dr. Bill Davidson up in Lebanon. I think there's 12 cardiologists in his practice, and they also have 12 secretaries secretaries that deal with all the forms. They're not gonna need 12 people. So some people like that are gonna lose jobs, but what do we think we're gonna gain? 140,000 new doctors and nurses jobs in our state, 1 point, that's another we have to increase.
Right, well, actually, we go the extra mile in terms of what we anticipate, what we know are going to be displaced insurance workers. And we give them a 2-year golden parachute, 2 years of income up to $60,000 a year to give them the opportunity to transition into the new healthcare economy. Plus, we give them $25,000 toward tuition or training costs related to that retraining. And we take very good care of anybody who is displaced as a result of this. And that's our way of saying it's not their fault that that's what their job is. But nonetheless, we go the extra mile. I think that ours is the most generous program in the country, so nobody's going to be damaged. Except for the CEOs who are pocketing tens of millions of dollars.
Board and among our statewide volunteers are doctors in many different practices, from family practice, pediatrician, Bill Davidson, who is going to be with us tonight, but had an illness in his family and he had to deal with. But he's a cardiologist. We have lots of physicians, Walter Sue in Philadelphia. Lots of physicians are on board our state single-payer plan. So we have, one of our doctors found out about this from one of his patients, and he's one of our most passionate supporters. So doctors, once they understand this program, really take to it and like it.
Okay, now we have 5 minutes, and I'll let you go 8 minutes. So we have 3 questions. Terry, John, Kate.
And let me ask a naive question. Why aren't businesses jumping on this?
I think
they're saving money.
I think there are probably 2 reasons. One is that they can't overcome the big government issue. That's number 1. And number 2 is, and we've had some conversations with some major businesses about this. Number 2 is that they're not convinced yet that the costs are costs that are sustainable for them and that they really do reflect much lower costs. The big government issue, philosophically, is the hardest thing we have to overcome.
Right, and I also, Dave and I have talked about this quite a bit, is that the business community and a lot of the small business people see themselves as part of the larger business community, when in fact the business community is aligned in such a way that the big business community is actually doing damage to the small business community. In other words, the small business community suffers much more greatly because they don't have the ability to self-insure, they don't have the ability to absorb these escalating, skyrocketing costs. So the business community needs to see itself as more distinct. It's not a monolith, it's not a single entity, if that makes any sense. John?
Thanks. Thanks a lot. Something that always seems to come up, and I haven't heard it yet, so I just have to ask. I know there must be an elegant solution in the law or in your ideas for this, but we always hear of the super issue of medical malpractice and tort law claims in the medical health field. So what's going on as far as this legislation?
Well, medical malpractice really consists of 2 parts. One is the medical care coverage, the coverage of actual medical care. The second part is the non-economic damages. We don't address the issue of non-economic damages, which is pain and suffering. We do not address that issue. If that needs to be litigated, it's going to be litigated. But the real cost of medical malpractice insurance, like most insurances, is the cost of health care, the cost of medical care provided to the injured party. And that goes away under this. So the whole need to litigate the costs of medical care go away.
And the defensive medicine that Dave was talking about, unnecessary testing, because the docs, the hospitals are afraid they're going to be sued. That sort of anxiety is going to tamper down. And we're talking about somewhere in the neighborhood of 6 to 10% of the entire healthcare cost are related to these contract-driven practices and other people with tort and so forth. This is actually the best solution on tort, this single pay.
So there's something for the doctors to allay the fear of being sued, because that's what we're always hearing about.
They follow the standards of medicine. They should have nothing to fear. That's the idea here. Is do real medicine. Don't do medicine that's beyond what it was you were trained to do. Do good medicine, and you will benefit.
How do you prevent the corporate lobbyists from the insurance companies from worming their way into and seducing the legislators of Pennsylvania to getting, some slice of his pie?
Well, what a great question. There's no question, and Chuck will want to comment on this, there is no question that the insurance companies will spend millions and millions and millions of dollars to defeat this. It's our money. But it doesn't mean that insurance companies necessarily go away. They need to change their business model because there are still other things that may relate to health care that aren't included in our. For example, the cosmetic plastic surgery. If you want to insure yourself to do that, fine. But it's going to be a much diminished industry. And that will be a very difficult sell. And the only way it's going to happen, I just repeat again, the power of the people will carry the day on this. If we have massive numbers of people calling our legislator and saying, we want this done, it will happen. That will overcome, ultimately, the insurance lobbyists.
This is where we came together. We had, in December 2009, we had the first in the nation Republican-chaired single-payer hearing, and we demolished the medical industry representatives, the pharmaceuticals, the hospitals, and NFIB, excuse me, the so-called representative for the small business community. We destroyed these folks in head-to-head debate and testimony. So we can and will prove that we'll win every single argument, that the role of the money, you're right, is in cities.